Gait cycle. The gait cycle comprises of the stance phase and the swing phase. Stance phase constitutes around 60% of the gait cycle and the swing phase around 40% of the gait cycle. The stance phase of a particular limb is the time during which that limb is in contact with the ground and supporting the weight of the body. The swing phase of a limb is the time when the limb is advancing forward and is not in contact with the ground. The weight is supported by the contralateral limb during the swing phase. Now let us see the subphases of the stance phase. The stance phase begins with the heel strike, that is, the heel comes in contact with the ground. This is also known as the period of initial contact. Following this, we have foot flat, in which the entire foot comes in contact with the ground. This is also known as loading response, and this is the phase where weight of the body is accepted. The next phase is mid stance, in which the body moves forward and comes to lie directly over the limb. The fourth phase is terminal stance phase, also known as heel off. In this phase, the heel comes off the ground. The last phase is the pre-swing phase, in which only the toe is in contact with the ground, and it is also known as toe off. The stance phase is divided into period of single limb support and double limb support. Single limb support is when only one limb is in contact with the ground, and double limb support is when both the limbs are in contact with the ground. The phases of double limb support are initial contact and pre-swing phase. Time in double leg support decreases with increased speed of walking, and it disappears in running, where it is replaced by double limb float. This is the time when neither limb is in contact with the ground. Now coming to the swing phase. Swing phase begins with initial swing. This is the period in which the foot is raised from the ground and the limb begins to move forward. The second phase is mid swing, in which the limb advances past the contralateral stance limb. And the third phase is the terminal swing, in which there is deceleration of the limb and the musculature of the limb smoothly stops the limb, and the limb is prepared for initial contact. Now let us have a look at the temporal or cadence parameters. These are distance and time measurements calculated during gait analysis. The first term is step length, and this is the distance between 2 feet during the double leg stance phase and is measured from the heel of the foot to the heel of the contralateral foot. The next term is stride length, and this is the distance traveled by one limb during its stance and swing phase, and is calculated as the distance between point of contact of foot at the beginning of stance phase and the point of contact by the same foot at the end of swing phase. So between subsequent steps of the same foot is stride length, and the distance between the heel of the one foot with the contralateral foot is the step length. The other terms are step time, which is the amount of time used to complete one step. Cadence is the number of steps taken per minute, and walking velocity is the distance traveled per time in meters per second. It is given by the formula cadence, that is steps per minute, into step length in meters divided by 60. Now let us have a look at the hip kinematics during gait. At the point of heel strike or initial contact, the hip is in around 30 degree of flexion, which undergoes gradual extension throughout the stance phase, reaching maximal extension at the heel off period. Then it starts to flex again and reaches around 30 degree of flexion at the next heel strike. Coming to the knee kinematics. At initial contact, the knee is flexed at around 15 degree. It undergoes extension till mid stance phase to neutral or minimal flexion. It again starts to flex till the beginning of the swing phase and is having maximal flexion of 40 to 60 degree in the initial swing phase. Then there is passive extension of the knee, and at heel strike we have again around 15 degree of flexion. Now let us have a look at the ankle kinematics during gait cycle. The ankle is in a neutral position at heel strike and undergoes 5 to 10 degree plantar flexion at foot flat. This plantar flexion of 5 to 10 degree from heel strike to foot flat is known as the first rocker. Then in the mid stance phase, the tibia moves forward and there is dorsiflexion of the ankle. This is known as the second rocker. Then in the heel off phase, the ankle plantar flexes again, preparing for push off, and this is known as the third rocker. During the swing phase, the ankle dorsiflexes back to neutral position to allow for clearing of foot. The next term is foot progression angle. This is the angle the foot makes with the path the subject is walking. So if this is the path the subject is walking, the angle the foot makes is the foot progression angle. Normal foot progression angle is around 10 to 15 degree of external rotation. Now let us have a look at the muscle activity during gait cycle. Gait is initiated through muscle activity, and transition of body to a steady gait pattern takes around 3 steps. Once a steady gait pattern has been established, gait is maintained by a combination of momentum and muscle contraction. Muscle contraction in gait can be divided into concentric contraction and eccentric contraction. In concentric contraction, the muscle shortens during contraction, and this type of contraction generates power and accelerates the body forward. In eccentric contraction, the muscle lengthens despite contraction, and this type of contraction is responsible for slowing and stabilizing joint motions during gait, which minimizes energy requirements. The number of eccentric contractions during gait cycle is more than the number of concentric contractions. Now let us have a look at some of the examples of concentric contraction. A powerful concentric contraction occurs during the terminal stance phase, which is the contraction of gastrosoleus. It contracts to pull the heel off the ground and push off the limb. The iliopsoas contracts concentrically, flexing the hip and pulling the stance phase limb off the ground at terminal stance and early swing phase. Together, gastrosoleus and iliopsoas are known as the two primary accelerators of gait. Another example is the contraction of tibialis anterior, which contracts concentrically during the swing phase, dorsiflexing the ankle. This provides clearance for the foot during the swing phase. Now let us have a look at some examples of eccentric contraction. The tibialis anterior contracts during the initial contact, and as the foot is plantar flexed during the first rocker, this smoothens this plantar flexion, leading to a gentle lowering of foot and prevents slapping of foot onto the ground. Another example is the contraction of gastrosoleus during the second rocker. During the second rocker, the tibia moves forward and the ankle dorsiflexes. This eccentric contraction of gastrosoleus smoothens this dorsiflexion, preventing excessive dorsiflexion. A weakness of gastrosoleus may lead to excessive dorsiflexion, which leads to poor push-off and calcaneus gait. Another example of eccentric contraction is the contractions of hip abductors, especially gluteus medius. This occurs during the weight acceptance in the stance phase. During this phase, the abductors contract eccentrically to prevent the opposite pelvis from dropping as the contralateral limb comes off the ground. A weakness of the abductors results in dropping of the pelvis to the opposite side during the single leg stance phase, leading to a Trendelenburg gait. So friends, in this video, we talked about the gait cycle. Understanding the gait cycle is very important for understanding pathological gait. If you like these videos, please hit the like button and subscribe to the channel for further videos. Also comment in the comment section regarding the topics you will like to be covered in the future videos. Thank you.